Coming back again to our workflow. Client admitted, that's when the intake clinician switches the person from intake to patient on the demographics form. Okay, the next tab or task or requirement is to assign a follow-up clinician. That really happens at this point when the intake person schedules that next appointment. Okay, so they really just need to schedule that next appointment and the system will take care of the rest based on what we've set up using those automations. Okay, if anybody has questions so far, let me know. Now we're gonna move on to the treatment plan becoming due after 30 days. Okay, we'll come back over to the workflow builder. We're gonna keep working on this very same workflow because it's all triggered at the same time. It all happens when the client is switched from intake to patient. So we don't really need to keep creating new workflows. We can just keep adding tasks into the same one, save ourselves a little work. We'll just name this one treatment plan. Okay, the form action to complete will say locking of. Locking is really like when it gets locked down, all the signatures have been applied. We're gonna say treatment plan. Again, F2. Whoop. Okay, and then we'll grab this custom treatment plan. We're gonna say it's due within 30 days of the admission date. So just in case the admission date is yesterday, and I forgot to mark it over from switch from intake to patient, I need to, make sure that the treatment plan becomes due 30 days after the actual admission date, not when I switch that. So I'm just making that change here. Who's responsible for this task? I'm going to say whoever the follow-up clinician is. Okay. We're going to alert this person 5 days ahead. So they're just going to get a message in their message board under the CA button. And it will just say you have a treatment plan coming due. The client discharges in this time, in this first 30 days, we don't need to do that treatment plan. We can mark the task as irrelevant. Okay, we don't need to filter the task, but it does reoccur. So this last bottom, schedule this task to reoccur. Clicking here. First thing, we need to start the reoccurrence. The default is based on the switch from intake to patient. That's not right for mine. Instead, I want it on the completion date of the prior plan. Okay, so if they complete it 45 days out, then the next due date is 90 days from that 45 days, as opposed to 90 days from when the client was admitted. Okay, if you want it based on the due date, so it's 30 days plus the 90 days, make sure you choose due date. Mine's on completion date. I want it on the 45 if they're 15 days late. And then I can just simply say 90 days, every 90 days. Okay, lots of other options in here, but I need 90 days, and it's going to end if the client is discharged.